Welcome everybody to this edition of Attention Talk Video. I'm your host, ADHD and Attention Coach, Jeff Copper. Today we're here with Dr. Sarah Cheyette and we're talking about ADHD and migraines. I know that when I have a headache, things are a little bit more difficult for me. I've never had a migraine, but it seems to me migraines would tax ADHD probably more than the average individual. And I'm also kind of curious, are those with ADHD more prone to migraines? Can you give us an education on this?
Yeah, Jeff, I think that there's not that much written about it, but it's a very interesting topic. Basically, when people have headaches or migraines, one of the causes that's often overlooked is that they may have ADHD, and the stress of the ADHD may be a trigger for their migraines. Also, as you mentioned, the migraines can make it even harder to function, and somebody with ADHD does not need another obstacle.
Do we know exactly what causes migraines?
Well, we think people are prone to them, meaning that there may be a genetic susceptibility. And what a migraine basically is that something irritates your brain, and there's a little nest of cells deep in your brain that sends out pain signals. So it's a headache that is sort of from the brain. It's not from a tumor, it's not from a sinus infection, it's not from an aneurysm or meningitis or any other itis. So it's what we call an intrinsic headache of the brain.
Interesting. And stress and stuff like that could actually trigger that, and ADHD certainly kind of causes stress. So it's like a kind of a double whammy.
Yes. Stress, as you know, is a biological reaction, and there's lots of hormones and other things released in your body. It causes physical consequences. One of them for a lot of people is migraines. Some people get stomach aches too. And all of these things can go together.
What role does stimulant medications play in this? Does it help migraines? Does it hurt, or do you know?
Well, as a treatment, stimulants are not a treatment for migraines unless they can make a big difference if there is an underlying ADHD. So if we can all of a sudden make it easy for them to think and function better, then whammy, the headache is gone. So
is it fair to say that sometimes if you're taking the stimulant medications help the ADHD, which may reduce and or prevent the migraines? Is that for not everybody probably, but for some people, it's an argument why they might want to try for medications, particularly if you have migraines, because it might inhibit those or minimize them.
That's right. If you're having frequent migraines, that's really what this is about. So lots of migraines. If you have a migraine once in a year, doesn't matter. But if you're having lots and lots of headaches, you want to look for the cause of them. One cause would be the ADHD. So treating the ADHD would then lead to cessation of the headaches. It's actually amazing. You don't take the ADHD medicine in order to get rid of the actual pain of the headache. We're talking about preventing them from starting in the first place. And I will also say that ADHD medicine sometimes masks tiredness, and that's, being tired is another cause of headaches.
Interesting. That makes some sense.
So people with ADHD. Yeah, people use the ADHD with people use the stimulant medicine with shift work disorders, so sleep disorders. If you need to be more awake, sometimes you take the same kind of stimulants, and that also will help headaches if the headaches are from not sleeping enough.
Okay. So in summary, if you have ADHD and you have frequent migraines, that could be an indication that your ADHD needs to focus on treatment, because you focus on the ADHD, it can help prevent and mitigate some of the migraines down the road, which is not, we have a tendency to treat with the symptoms, like the headache that's there, but actually treating the ADHD is probably what you should focus on. Is that right?
It's always nice to prevent the headaches instead of having the headaches and then having to take the medicine for them. So if there's a way to prevent them from happening, that person is going to be so much happier.
Absolutely. So Dr. Cheyette, I really appreciate the education. I know the people out there that have migraines and ADHD, I know you're listening to this. I hope you found this of value. So thank you so much for coming on the show.
Thanks so much for having me, Jeff. It's always fun to talk with you.
Take care.
You too.